The Essential Guide to Cervical Health. Every cell tells a story. Every change can reshape our destiny. Today, we're diving deep into a topic often whispered but rarely shouted: cervical cancer. Unmasking myths, understanding truths, and exploring groundbreaking advances. Let's decode the enigma of our times together. Cervical cancer is a type of cancer that originates in the cervix, the lower, narrow part of the uterus that connects to the vagina. Often has no symptoms in its early stages. However, when symptoms do occur, they include abnormal vaginal bleeding. This is the most common symptom. It might be between periods, after intercourse, after menopause, or heavier and longer lasting menstrual periods than usual. Pain during intercourse. Discomfort or pain during sexual activity can be a symptom. Unusual vaginal discharge. This may be watery, bloody, or have a foul odor. Pelvic pain. This can be a dull ache or sharp pains, sometimes constant and sometimes intermittent. Painful urination or blood in the urine. Advanced symptoms. In more advanced cases, there might be leg pain, swelling in one leg, fatigue, weight loss, or back pain. It's important to remember that many of these symptoms can be caused by conditions other than cervical cancer, such as infections or benign growths. Regular screening with pap smears or the newer HPV DNA tests is vital because they can detect precancerous changes in the cervix before they develop into cancer. Early detection greatly improves the chances of successful treatment. Let's delve deeper into the topic of cervical cancer, its risk factors, its pathogenesis, screening, and prevention. Pathogenesis and risk factors. Cervical cancer begins when healthy cells in the cervix undergo genetic changes that allow them to grow uncontrollably and not die. Over time, this can form a tumor. The primary cause of these changes is the HPV. Here are some risk factors. HPV infection. It's the most significant risk factor. There are many types of HPV, but only a few, like HPV 16 and HPV 18, cause most cervical cancers. Smoking. Tobacco byproducts damage the DNA of cervix cells and contribute to the development of cervical cancer. Immunosuppression. HIV or medications that suppress the immune function increase the risk. Other sexually transmitted diseases, STDs. Having multiple STDs may increase the risk. Multiple sexual partners. The more partners, the higher the risk of HPV. Early sexual activity. Engaging in sexual activity from a young age. Other factors: poor economic status, family history of cervical cancer, screening. Pap smear or pap test. By scraping cells from the cervix and examining them under a microscope, abnormalities can be spotted. Women are typically advised to start getting pap smears from age 21. HPV DNA test. This determines if the cervical cells are infected with any of the high risk types of HPV known to cause cervical cancer. Prevention. HPV vaccines. Vaccines like Gardasil and Cervarix protect against the most common types of HPV that cause cervical cancers. They're recommended for young females and males. Regular screenings. Pap smears can detect precancerous conditions of the cervix. Practice safe sex. Using condoms can reduce the risk of HPV and other STDs. Limit number of sexual partners. Fewer partners mean a lower risk of HPV infection. Don't smoke. Smoking is linked to increased risk. Treatment. Once diagnosed, the stage of cancer dictates the treatment approach. Early stage cancers might be treated with surgery, like hysterectomy or removal of lymph nodes, while more advanced cancers might require radiation therapy, chemotherapy, or a combination of these. Prognosis. The survival rates for cervical cancer depend on the stage of cancer when it's diagnosed. The earlier it's found and treated, the better the prognosis. Regular screenings can often detect cervical dysplasia, precancerous changes before they progress into invasive cancer. This is a summarized overview, but cervical cancer is a broad topic with many nuances. It's important for individuals to consult with healthcare professionals about any concerns or for more detailed information. Let's delve deeper into the topic of cervical cancer, its risk factors, its pathogenesis, screening, and prevention. Molecular biology and pathophysiology. The changes in the cells of the cervix that lead to cancer don't occur overnight. It's a series of changes that often span years. HPV and cancer. The virus introduces its DNA into the host cell's nucleus. Certain proteins produced from HPV's DNA, notably E6 and E7, interfere with cell functions and can lead to uncontrollably dividing cells. Integration into host genome. The DNA of high-risk HPV types can integrate into the host's DNA, disrupting the normal function and potentially leading to cancer. Stages of cervical cancer. Staging helps determine how advanced the cancer is. Stage 0. The cancer is only in the top layer of cells lining the cervix and hasn't spread deeper. Stage 1. Cancer is found in the cervix only. Stage 2. Cancer has spread beyond the cervix but not to the pelvic wall or the lower third of the vagina. Stage 3. Cancer has spread to the lower third of the vagina or the pelvic wall. Stage 4. Cancer has spread to the bladder, rectum, or other parts of the body. Advanced diagnosis. Besides pap tests and HPV DNA tests, the following are used for diagnosis. Colposcopy, a procedure in which a special magnifying device is used to visualize the cervix. Biopsy, removing a small section of tissue for examination under a microscope. Cone biopsy, a larger cone shaped piece of the cervix is removed to examine for cancerous cells. Advanced treatment options. Targeted therapy targets cancer specific genes, proteins, or the tissue environment contributing to cancer growth and survival. An example is Avastin. Radiation therapy. High doses of radiation are used to kill cancer cells. Chemotherapy uses drugs to stop the growth of cancer cells, either by killing them or stopping them from dividing. Combination treatment. In advanced stages or aggressive forms of cervical cancer, a combination of surgery, radiation, and chemotherapy might be employed. Future perspectives in research. Immunotherapy. Emerging treatments which boost the body's natural defenses to fight cancer. MicroRNA research. Scientists are studying changes in levels of certain microRNAs in the blood, which might detect cervical cancer. Gene expression profiling. Studying patterns of genes expressed in the cancer to predict a patient's prognosis. Follow up and rehabilitation. After treatment, patients go through regular checkups to look for cancer recurrence. Rehabilitation may be needed depending on the severity and treatment procedure, addressing sexual health concerns, lymphedema, or other side effects. Epidemiology and global impact. While screening and vaccination have significantly reduced cervical cancer cases in many developed countries, it remains a major health concern in many low and middle income countries due to lack of screening infrastructure and HPV vaccination programs. Cervical cancer embodies the complexities of modern oncology, intertwining virology, genetics, prevention, and treatment. As always, this is just a snapshot, and the topic is vast and ever evolving with new research and findings. Well, folks, we've journeyed deep into the world of cervical cancer today. It may seem like a game of chance, but guess what? We've got the power to spin the wheel in our favor. Bingo, regular checkups. It's like our golden ticket in this game called staying healthy. But don't just rely on luck. Equip yourself with the knowledge. Take preventive measures, and remember, you're the champion of your own health story. So before we sign off, make sure to give that like button some love, share the wisdom, and subscribe for more empowering health journeys. Till next time, be informed and stay proactive.